Fine. So today we are discussing about the comparison of the Da Vinci models, SSI Mantra. This is a modern era of robotics. Already in the first 2-3 classes, we were discussing about the robotics, what is the importance of robotics, advantages of robotics, how do you operate it, how do you dock it, now what are the applications of robotics. Now compared to the modern era, that is now right now in 2024, 2023, 2022, 2025. So these are the called modern era of robotics. So comparisons of the Da Vinci models. We only operates Da Vinci, other is Ugoras, and other is SSI Mantra. Whereas we now in India, these two are famous, Da Vinci and SSI Mantra. So today we'll be discussing about the comparison of Da Vinci models and SSI Mantra. So modern models of Da Vinci surgical system have three major components: the surgeon's console, the patient side card, and the vision card. Got my point? The Da Vinci S system released in 2004 provides a highly magnified three-dimensional HD view. I repeat once again, in 2004, Da Vinci S system has evolved. It provides highly magnified three-dimensional HD view of surgical area. It was designed according to a humanoid concept. Three-dimension nothing but when you're operating, you should know how the structure of the human body is there and what is your major target organ. Done with endorsed instrument, allowing a high degree of freedom of motion. Already been discussed, these are the 360 degrees, whereas in laparoscopy, only 180 degrees, whereas in robotics, 360 degrees. Got it? Any doubt till now? So the addition of a fourth manipulator arm and a slimmer arm design enabled greater access with abdomen than that provided by the earlier version. So previously, hello?
Yes, sir.
Yeah, is it audible now? Did the point understood previously? The Da Vinci system was having a two-dimensional arm. Now here we are having three-dimensional arm. Three-dimensional arm, nothing but one arm will be the at the camera port. Other two will be secondary ports. Secondary ports is nothing but to operate in a three-dimensional wave. Previously, 2004, it was not like that. Till now, it's okay. The addition of a fourth manipulator. Now, after 2004, the fourth arm has started. Fourth arm is nothing but extra secondary accessory port. Why it was designed? Because in order to assess the greater target organ in such a way that all surgery must go smooth. That's why. The camera and the arm are connected with separate 12 mm trocar. Yes, what I have told you, primary trocar is nothing but primary port where the camera will come, that is 12 mm. The Da Vinci SI surgical system released in 2009 is a full HD vision system characterized by dual console mode with the ability to connect two operator consoles, allowing real-time teaching, surgical collaboration, and telemonitoring AS with Da Vinci A surgical system. I'll tell you. Previously, it was only two arms, then followed by three arms. It is a three-dimensional. Now, as the time progresses, the HD system comes into an action. So, in such a way that the camera accessibility, depth of the perception, and 3D magnification must be so highly consoled in such a way that one operation can be operated by two surgical consoles. Two surgeons can operate at a time. After 2009, this is the main advanced Da Vinci SI surgical system. And the camera is attached to 12 mm trocar. Why? Because it has a double vision in such a way that it should be 3D magnified. So Da Vinci XI surgical system is the another advanced Da Vinci came into picture in 2014 as an easier docking system and a wide range of motion with smaller, thinner arms. Now, previously in 2009 compared to 2014, it has been evolved in such a way that it must go as smooth surgeries. The endoscope can be attached to any arm. The overhead rotating arm suspension and anatomical targeting system provide better anatomical access for multi-quadrant operations. Simply, what I mean to say means, Da Vinci, as the year progresses, it has evolved, it has changed it multiple accessibility in such a way that the surgeries must go smoothly. So in 2017, Da Vinci, another model came with a system called Da Vinci X. It is a hybrid version of Da Vinci SI and XI. Previously, it was S, then SI, then XI, then X. It uses the same vision chart and surgical console as a Da Vinci XI system, but the arms of the XI system are installed on a Da Vinci SI frame, resulting in XI surgeon console and vision card and an SI patient card. It's nothing but it has evolved in such a way that it has multiple accessibility and in order to decrease the errors for the surgery. So Intuition is the surgical system where it produces different version of Da Vinci robotic surgery system. So what are the main types in recent years evolved is SI, then XI, then X, then SP, and the latest is DaVinci 5. And DaVinci 5 system is the evolved system from 2004 to 2019. DaVinci 5, it has evolved in such a way that it has created a lot of changes. Like in laparoscopy, we were using previously what you called multiple arms. Now it has decreased to single port. Similarly, Da Vinci, it started from SI, it ends with Da Vinci 5. Now, starts with Da Vinci SI. What do you mean by Da Vinci SI? Da Vinci SI was a predecessor to the more advanced models, but it brought significant upgrades. What are the upgrades? High definition 3D vision and improved surgeon console. So, as the year progresses, the advancement get increases. So, more depth perception, more advancement in camera, and more advancement in surgeon console. In such a way that the surgery must go smooth and it has decreases the operating time. The SI model could be used for a wide variety of minimal invasive surgeries. Distinguishing technology, it introduced dual console capability. The dual console, nothing but two surgeons can operate for a single patient. It has started from SI. Got it? So it can teach, one surgeon can teach, one surgeon can do the procedure. Da Vinci XI, it introduced in 2014. The XI system is designed for broad procedure versatility and is most advised to use multi-port system. Key features. Now, what is usage of Da Vinci XI? Previously, it was Da Vinci SI, is XI. Features are the patient cart has an overhead boom architecture, allowing the surgical arms to reach any part of the body without having to be redocked. So it has evolved in such a way that the docking system gets very established and it can move in all directions. Optimized, where it used optimized for complex surgeries, multi-quadrant surgeries such as involving both abdomen and chest surgeries. Nowadays, cardiothoracic surgeons, they are doing robotic surgeries. Why? Because Da Vinci XI. Lot of Indians are using Da Vinci XI right now also. Why? Because it has evolved in such a way that it can do abdomen and chest surgeries. Right? Now, what is technology used? Advanced instrumentation, that is 3 mm. Then the instrument, that is 360 degrees. It has been evolved. Imaging quality, yes. Firefly fluorescence. Firefly fluorescence technology is nothing but, suppose if you are having any doubt for tumors, either benign or cancer, you can ask your assistant to start fluorescence technology where the patient card has its own arm for visualization of blood flow and compatibility with integrated table motion. Got it? Point. This is the importance. Now coming to Da Vinci X, Da Vinci XI, it introduced in 2014. The XI system is same as I've already told you. The technology has been evolved. Now it has been established in such a way that the depth of perception will be more and more technology has been evolved in Da Vinci XI. Now coming to the next point, Da Vinci single port. Now, as the day progresses, now what we are coming, single port, it contains all camera and working port. A single camera, single port consists of camera and working ports. So no other ports. In single port only you can operate. This is called Da Vinci SP, single port. The single port system is a specialized platform for single incision for national orifice surgeries. A single arm deliveries, only single arm is utilized. It can be multi-joint instruments. It has a flexible 3D HD camera through a 25 mm port. So port will be 25 mm in which all camera will fix, all instruments can fix. So primary for procedures, it requires also to access narrow space, transoral, urology, some colorectal procedures where you can do in a single port. Got it? Its unique arm and instrument architecture allows for distal triangulation inside the body, eliminating the external arm clashing common. Suppose when you're using 3 arms, you can clash. Whereas in single arm, you don't have any clashes. Till now, get it? Any doubt?
Oh yes, I'm cle- I'm it is clearly audible and the
Okay,
matter is
thank you. Sure. So, when we are evolving from 2004 to 2024, I am telling that it was started by multiple ports, then followed by single port. This is an evolution. So it's an advanced technology. And from HD camera to 3D HD, depth of perception is changed. Now you are using fluorescence technology. You can use single port. You can, if you have any doubt, you can go for fluorescence technology to rule out any complication in the blood vascular system. And there is no clashes of multiple arms. So the Da Vinci 5 came to in picture in 2024. It is more recent advance in such a way that it integrates 150 innovations and offer vastly more computing power. AI, artificial intelligence, come into the picture in 2024 in such a way that single procedure within 30 to 35 minutes you can complete very easily because of single port system, single camera, single port, multiple arms in a single port, 25 mm port you can see without using any double arms. Only single arm you can use and you have a lot of well adaptable technology. For the first time, surgeons can feel the push and pull forces on tissue. In 2024, the Da Vinci 5, you can feel it like you're operating like a laparoscope, leading to more precise control. I told you initially, haptic mechanism, that is a touch mechanism, is not there in robot. Okay, whereas in laparoscopy is there, but it's partial. Whereas in open, we can touch the patient. You can feel the patient, whereas in robot, you can't. But a new technology came into picture in 2024. He says that you can feel, you can push, you can feel the force of the tissue. And it has a more advanced 3D vision system. The concept has been redesigned for a greater surgeon comfort. Previously, what had happened, we used to like this. Da Vinci S. Now Da Vinci 5 is like this. So what is happening? Da Vinci has been evolved in such a way that the surgeon must have a comfort. When there is no comfort for the surgeon, you can't operate very easily. Got it? Right. So these are the important Da Vinci evolution.